We're going to have you say your name and spell it and your title.
Okay. I'm Liz Tam, T-A-M as in Mary, M.D. I'm professor and chair of the Department of Medicine at the University of Hawaii John A. School of Medicine.
You have a unique history and wealth of experience, really, with what's happening right now on the Big Island, with the concerns about the air quality, with the eruption that's now spread, the eruption spreading. Why do you where does that experience come from?
Oh.
Maybe you can tell us first.
Okay. Well, you know, it results from a very important collaboration between the Hawaii Island community and academic partners at the University of Hawaii in the John A. Burns School of Medicine, the School of Ocean and Earth Science Technology, and also with the Harvard School of Public Health and the University of Southern California. So we all got together at the request of Hawaii Island to come study the volcanic eruption, which has been going on since 1982. At least this last one has been going on for a very long time. And the people of Hawaii really wanted a study of the respiratory health effects. They could not find, you know, the expertise to do it. It was very hard for Harvard and USC, who are really the experts in respiratory epidemiology. It was hard for them to get it done, but we worked out a partnership, an academic community partnership to study the respiratory effects of volcanic air pollution. Our studies were patterned after very important studies done by the Harvard School of Public Health and the University of Southern California in their Children's Health Study and in the 24 City Studies by Harvard. And we adapted those major, very important studies to study volcanic air pollution. And I have to say, we all learned a lot. We learned a lot. The academic partners learned a lot from the community, and the community actually did the studies. We had community-based participatory researchers doing the study. So it was fun. We actually started our study in 2002. And it was a study of almost 2,000 Hawaii Island school children from, at the beginning, 29 elementary schools around the island of Hawaii. And we studied their health and their parents' health, and we also at the same time measured the air quality in the areas near their schools. Now remember, the main vent during that time, 2002 to 2005, was Pu'u O'o'o. And that has been very active on a good day, meaning when it's considered a pause. On a good day, it puts out 300 tons of sulfur dioxide. And to put it in perspective, there is a generator outside of Cleveland, Ohio, where the EPA would shut it down if it hit 300 tons in a year. Okay, so our volcano on a good day was putting out 300 tons. And during the time of our study, it sometimes would put out 2,000 to 10,000 tons of sulfur dioxide every day. What we learned and appreciated working with our partners, and also very importantly the Department of Health, the Clean Air Branch, because they have monitors up, and we kind of worked with them. We added some of our own monitors, but we studied what happens with that sulfur dioxide emission comes out of the volcano, and then it's caught under an inversion layer that's usually about a mile high. So it doesn't just blow off into the outer atmosphere, it gets caught under a mile-high inversion layer. then remember there are all these tall mountains on Hawaii Island. So the Vog can't hop over the mountain, and it would have to wrap around. And you know how we have usually trade winds that come from the northeast? So the trade winds, we learned, would blow the Vog down south of Hawaii Island, and then it would wrap around the mountains and get stuck actually in the Kona side, because you know the land mass next to the ocean mass, the land mass would warm and it would pull the air in from over the ocean, and then at night that mountain air would cool and come down from the mountain, push the Vog out, but it would the Vog would kind of puddle there. So we learned a lot first of how sulfur dioxide, how much is emitted from the volcanoes, and then how it's distributed by the wind around the mountain and under the inversion layer. Some very important partners were researchers at the U.S. Geological Survey. So really it was all kinds of partnerships that continue to this day. We have periodic phone calls, and we still continue to communicate. So we had to define the environmental exposure, and then we recruited the children to participate in this study. And here we had planned for maybe, not that many. We figured we'd need about 1,800 or so. And we were told, no one's going to do this study. It takes too long. You're doing all this kind of stuff. It pulls them out from the schoolwork. But I think because of our community researchers who knew everybody, they knew the schools and the families, and they adjusted the questionnaires that Harvard and USC had generated, and they made it really local. So they took out chimneys, they put in catchment, we had geckos, there are different questions. It became really our own, the community's own questionnaire. And because of that, I think we got a lot of people, a lot of children and their families to participate in this study. We actually got almost 2,000, more than we had actually budgeted for, but Hawaiian style, we said, okay, come in, we'll adjust, and we took everybody, and they answered, an 80-question questionnaire that was 14 pages long, and they did, we measured their height and their weight, and we studied their lung function. So we actually had these 8 to 10-year-olds doing spirometry, which takes some effort and some learning, but they were great. And they did very quality measurements. So we were able to do that, and we started a study that at first was supposed to just go 3 years, funded by the NIH, the National Institute of Environmental Health Sciences, and then subsequently by the Centers for Disease Control and Prevention. So actually the study ran from 2002 to like 2011. It went 10 years. And we were able to study these children once or twice a year, every year, for 10 years of their lives. And they came every year until they graduated, of course, because all these studies were done in the schools. So really, I don't think people should thank me too much. I thank the people of Hawaii Island and all of our partners, because they gave everything. The schools really encouraged it. They welcomed us into their health room so we could do the studies. They adjusted their schedules. It really was a big undertaking. If you think 2,000 children every year for 10 years, right? So it was really fun. But out of that whole endeavor, we did have some surprises. We found that the prevalence of asthma is actually higher in areas where there was intermittent smoke, Vog. It didn't, what we were surprised to find was that Vog maybe doesn't cause asthma. We did find that if you already have asthma for a variety of reasons, usually it was because you had allergies, it was in your family, the environmental tobacco smoke was a big factor. If you already had developed asthma, then the Vog definitely would affect those with asthma more. They were more likely to get upper airway symptoms and cough. So that was pretty clear. But things like bronchitis, it wasn't as pronounced an effect there as we see with traffic-related air pollution, or as in the 24 cities, the urban air pollution. Does that make sense?
Yes, it
Okay.
totally does. Now tell me, you said the community did the research. How so?
Okay. First, we as part of our initial grant, we had an advisory board of community members. Mayor Kim was on that, the Civil Defense. We had representatives of the Department of Health, and the local leaders. So they helped us help us get the questionnaire. They also recommended people who might be able to help us do the work. So our research assistants were people who were not really scientists. I think one or two of our people had maybe taught science in biology in high school, but we had retired bankers, sociologists, waitresses. They all had different lines of work, and not all had been trained in science at all. The scientists from Harvard School of Public Health and USC came and they taught us how to do everything, and it was wonderful.
So what kind of jobs are we talking about that they would be doing as research
Okay.
assistants?
So once we hired them on, they actually went into the schools and they told the families and the school staff about our study, and they figured out how to recruit students into the study. They learned how to get informed consent from the families. They helped do the questionnaires. Now, there's a certain way you can't, when you do the questionnaire with the student or with the families, you can't lead the answer, right? So you have to ask everything straight up. It was done very scientifically, and they were taught all by our scientist friends at Harvard School of Public Health and USC. So they actually helped, send out the studies, collect them, compile. They did all the data entry. They also did all the measurements of sitting height and standing height, which had to be done exactly. And that data was used then to put into the spirometers. And I'm sorry, I didn't bring, I didn't bring one. It would be good to show it. But they actually conducted all the spirometry out in the schools. And when our colleagues at Harvard and at USC saw the quality of that data, it was impeccable. It was very consistent, it met guidelines, it was top quality, and it was consistent throughout all the 10 years. So those are the main things they did, but they also put up the monitors to capture the acid, the sulfur dioxide. They measured everything. And we devised it, so we had a system. So the field workers would put in all the conditions and how they collected the filters from the monitors. And then we sent it off to be analyzed. But I made it so that neither side would know what the true answer was. they had to do it together. So Harvard would measure all these filters and say which ones had the higher sulfur dioxide or the Vog particles, which are very acid. So they'd know over there, but it had no meaning until they put it in the context. And our community researchers were the first to see that, oh, this filter with really high acid is from Kealakekua. Or this one, which is only very little, is from Hawaii. And for the Harvard people, they didn't know what all these words meant. But it was actually our community-based researchers who began to put two and two together first, because the data came to them first. They knew the context, and they were the first to see how there was sulfur dioxide here in this area, and up here was more acid.
Acids in what way? What is that?
Yes, so sulfur dioxide is an odorless, colorless gas, and when it rises in the atmosphere, it interacts with water vapor. And then sulfur dioxide and H2O combines, and actually what results is sulfates of sulfuric acid, and then sulfates are very acid. We would have to collect the particles on filter paper that was then protected from any ammonia or other bases that could be in the air, because then they would neutralize the particles. So they were all trained to capture it exactly as Harvard had done in its 24 city studies. So the acid, the sulfate, is a product of sulfur dioxide. And the way it works is sulfur dioxide comes up, it gets blown, around the island, and in 6 hours, about half of it turns into sulfuric acid or sulfate. So you can see as it goes up around the corner, up into Kona, and then it dwells there for a long time, like days, 2 weeks, it gets more and more acid. So the Kona side of the island tends to be very high in acid particles. The south side in Ka'u, like Na'alehu and Pahala, it's more sulfur dioxide with some sulfate. And then Hilo side, which is usually upwind of the volcano, if the wind backs up, goes backwards, they'll get the sulfur dioxide mix. And there's one part of the island up in Hawaii, Kapa'au, they don't get much fog most of the time. In fact, we had a monitor up there, but it was so boring we took it down. So I don't know if that makes sense, but around the island of Hawaii, you can get different kinds of exposure and different amounts of exposure.
Based on what you learned in this study for 10 years, what are your concerns right now?
Okay, right now, let me tell you, ground zero is very different from anything we studied, okay? So imagine none of the schools we studied is going to be near a volcano. It's just not safe. So most of our schools were at least 20 to 50 miles, at least that far from the volcano. Ground zero right now in the Leilani estates, they are getting extraordinarily high levels of sulfur dioxide. I'm told that periodically they're hitting 100 parts per million. And when we were studying the kids, 1 part per million, it never happened. It didn't go to 1 part per million when we were studying the children. Okay, so right now in Leilani Estates, it's hundreds to almost 1,000-fold higher than anything we studied with these children. So that's why it's just so very different. That's almost occupational level exposure. It's disaster. And that's why we tell people, I don't think a mask is going to help. The worry about wearing masks, I mean, it'll help, but people might get a false sense of security and stay there. And at these levels that sometimes blow, where people are in Leilani Estates, it's very dangerous. So, and the thing about the emissions, the lava, the wind speed and direction, all of those things are so unpredictable, and they change in the blink of an eye. So even if at the moment you might be okay, a shift in wind and it'll pull that plume right towards you. And even at, 10, 20 parts per million, that gas may be odorless, and you may not know it, but it's sulfur dioxide, it's not oxygen. So it's dangerous. I would not stay near the vents.
And that's why they've taken the residents back in for a short period of time. Get your stuff, get out. Reporters,
yes.
Get your stuff, get out.
Yes. Don't linger there. You just have no idea. If there is a wind shift, it'll catch you.
What
the other thing about
need to do for the future? Yeah.
Well, the other thing I want to say about ground zero is there's sulfur dioxide, but also remember the lava is causing homes to burn and vegetation. So you not only have Vog, you have smoke. And like when homes burn, there's plastics, rubber, all kinds of things. So it's a toxic mix that is much more than just the volcanic emissions.
That's a very good point.
Mm-hmm.
Very good point. So what's needed for the future?
How future?
I mean, right now, in terms of research, in terms of, you found if you already had asthma, you might get worse, but do you have a long-term concern beyond 10 years when these kids turn 50 or?
Well, we would like to. I mean, we have the names, and conceivably when they turn 50 or hopefully before then, we'll be able to go back and we have a repeat questionnaire about it's a gem of a study. It's a resource. I think we learned a lot about our own people as much as we learned about the volcano. We really recognize the racial changes, or not changes, but variations around the island of Hawaii. We learned about allergies, smoking habits, environmental tobacco smoke, how the homes are built. Those things all figure in what kind of environmental exposures a child is having. So in the long term, for the more chronic, low-level sulfur dioxide exposure, a repeat or follow-up study when the kids are in their 30s, and maybe a repeat again when they're 50s might be helpful. But in the 10 years of study, we saw we didn't see a higher rate of developing asthma. We did see if you already have asthma, it does make you cough more. And some of the other differences we saw, we could probably ascribe to differences in the racial distribution and the
genetics, right?
Right, and the socioeconomics. There you go. Also differed. So it turned out to be a lot more complicated, but it was just a joy of a project to do because of our partners in the community and at the other academic centers.
What were the ages of the children?
We started when they were 8 to 10 years old until they graduated.
Wow.
Yeah.
All right. And is there anything I haven't asked you want to say?
No, this is great.
No, this is very good.
Yeah.
Maybe we can follow up and get some kind of pictures of the
Okay.
study. I know you had, I think I took a picture one day when you were showing Leland Kim one of your monitor things.
Right, the monitor things.
Yeah. And then you had a picture of some kind of like a pole on top of an
Yes,
island.
yes.
Right?
I can send you
that helps.
those.
Okay,
Okay.
great. And then, yeah, we'll see what we can get from Ocean Earth
Oh,
Sciences.
Oh,
Maybe we can
yes,
get some
very
pictures
interesting.
And, because this is a great, like you said, University of Hawaii and Harvard and USC.
Yes.
Did you go to USC then for your residency?
I was at Harvard.
Okay.
So Brigham and Women's Hospital,
Alright.
yes, I was there.
So that's how you know it's the
And
leader.
it's very interesting, but when I was at UCSF, I actually did my first study with Homer Boucher, Jay Nadell at the Cardiovascular Research Institute, and we studied the effects of sulfur dioxide. I never knew I would see it again, but I did that as a first-year medical student.
Wow.
And then many years later, I'm called on to go study this gas. I said, oh, I know that.
You were not a JABSOM grad?
No,
I never.
I graduated from UCSF.
Oh, wow.
And then my internship residency at Brigham and Women's, it's a combined respiratory program. And then I actually did my fellowship at both CVRI at UCSF and in Harvard, Brigham. So all these people is
all
great.
that back.
Hey, and then to a volcano that's been here all this time.
Yeah, and I find it interesting too. You said all volcanoes are not the same.
Oh, but they're very different. They're very different. Hawaiian volcanoes, they're shaped like a shield, so they're called shield volcanoes. And they're that shape because the lava flows slowly. Whereas if you look at Fujiyama, that's a cone. Cone volcanoes, they explode. Vesuvius, and I think the ones that blew in Iceland with all the...
Mount St. Helens too.
Yes. Just look at the shape. You can tell. That one's going to explode. This one's going to be more of a, slower and usually sulfur dioxide emissions, gas emissions. So very interesting. But they're very different. I should mention too that it's more the cone volcanoes that have the ash, lots of ash, like Mount St. Helens. And ours, not so much. But, at ground zero, they're getting ash.
Because
So
of
those are
fires and the
no, yes, some, but some is from the volcano. When you're that close, there are some particulates that will stay there. And I understand that in a few days, if the water goes on top, we may actually have boulders.
Yeah.
So it really depends on the kind of volcano, how close you are to it. Big particles, boulders, for instance, they don't float around and go 50 miles away, but it's confined there. Gas and these very small acidic particles, which are 2.5 microns or smaller, they float and they travel. And they will sometimes come to Oahu, for instance, right? So the size of the particle also makes a difference in how it gets distributed. Fancy.
It's very interesting.
Yeah,
You
it is.
had to become a geologist and
Yes.
all that stuff.
It was so fun. It was very multidisciplinary. And, along the way, we had to learn about mold and pollen because those are in the mix on Hawaii Island. And cattle, because it turns out ammonia will neutralize the acid. So we couldn't put our monitors near meadows with cows in it, and we had to just be very careful. It's interesting how these things from their
methane.
manure.
Yeah.
Yep. And in fact, even in the 24 city studies, they found that the acidity would decline around cities, and it's just from the humans, water vapor, sweat, perspiration. We give off ammonia. Isn't that interesting?
It is.
Yeah. Anyway, what time is it?
Okay. Oh, 4:30.
Much we can do. But this one really focused on the volcano,
Yeah.
the volcanic. The subsequent papers may start to, we'll be able to show some of the other things about how the other determinants of asthma. Once we got the volcanic air pollution, settled, it's mainly in that first paper.
Wow. Because, I've never heard you talk at length about it, and I'd never read your research. So reading this, really, I was just like, holy we've got to
and
tell
see,
somebody.
we purposely did it that it didn't go into. We waited for Environment International because people can just download it. They don't have to belong to the American Thoracic Society or pay $25 to get it. We wanted open access because many of the populations that live in the shadow of a volcano, we're lucky if they have internet, but they won't be able to have a library to get it. I just wanted to have them have it available. And there's one part, the part you can print out, but there's another part with the supplemental information, which isn't peer reviewed, but they said you could put anything in it. I put everything in it. I put in the questionnaires. I put in all of our readings from our monitors and the Department of Health from 2000 to 2010 from all around the island, just in case people wanted to go back and maybe do an emergency room study from Hilo Medical Center. They could see that in the months of this and that, this was how high the air pollution was in Hilo. Because before this study was done, the problem was if people did these emergency room studies, they would report that, but they couldn't report what the air quality was at the time. You kind of had to guess that it was happening at the same time, but it may not have been because it's so variable. But here, people will be able to go in and kind of reconstruct. So we tried to put in as much in there that people could use for future studies.
Fantastic.
Yeah. Good.
Awesome. Okay.